Hello guys, welcome back to my channel, and in this video I will be discussing valvular diseases. My name is Abhay Patan, so let us begin. So guys, first of all we need to understand what is valve. So valve is a structure present in the heart which presents backflow of blood. Okay. Now coming to the stenosis. So it is basically failure of valve to open completely. Okay, like a stiff wall that resists blood flow through it. Okay, so imagine it like this: rubber band. Okay, a rubber band, it is a very stiff. Okay, so it won't allow blood to go inside the ventricle. Okay, or inside the aorta. Okay, so example is the calcification or the valve scarring. Okay, and exactly opposite is the insufficiency or the regurgitation. Okay, it is basically failure of valve to close properly, causing regurgitant or backflow of blood. Okay, and the examples are the endocarditis or leaflet scarring and retraction. So first disease which we are going to talk about is acute rheumatic fever. It's a systemic complication of pancreatitis due to bacteria called as a group A beta hemolytic streptococci. Okay, and if this disease is untreated, then we get this acute rheumatic fever. Okay, and it affects children 2 to 3 weeks after strep throat. Okay, and guys, this bacteria has some antigens. Okay, which are similar to our tissues. Okay, so this bacterial M protein, which is also called as the antigen. Okay, it resembles human tissues. Okay, so our immune system gets confused between these, between bacterial M protein or the human tissue. Okay, and our immune system, it attacks our own cells. Okay, so that's why we call it as a autoimmune disease. Okay, and guys, this word is very important: molecular mimicry. Okay, molecular mimicry. Okay guys, now coming to the diagnosis of this disorder. So diagnosis is based on Jones criteria and evidence of a prior group A beta hemolytic strep infection, ASO, or anti-DNase B titer. These are some tests by which we can detect this bacteria in the blood. Okay, and we have got two criteria also: minor and the major criteria. Minor criteria includes fever and elevated ESR. ESR means erythrocyte sedimentation rate. Okay, and major criteria include the Jones. So in Jones, J stands for joint. There is some migratory inflammation in the ankle joint, in the neck joint, in the wrist joint. Okay, O stand for heart. There are some complications in the heart, like valvular disease, especially the mitral stenosis. Okay, and it stand for nodules. We see nodules on the skin. Okay, E stand for the E, E erythema marginatum. In this case, what happens that in our skin we get patches of blood, like substance. We get stains, and which are in margin. Okay, so that's why we call it as a erythema marginatum. Okay, and S stand for chorea. Okay, so I can't pronounce it because it is way too difficult. It is called as a Sydenham chorea. Okay, Sydenham chorea. And in this case, what I mean that our muscles, they involuntarily move, involuntarily move. Okay. Now coming to the aortic stenosis. So narrowing of aortic valve orifice. Okay, and it is usually due to fibrosis and calcification from wear and tear. Okay, and it is present in adults. Okay, And guys, this bicuspid aortic valve increases risk and hastens disease onset. Okay. So guys, what do we know about aortic valve? So aortic valve is a tricuspid valve. Okay. As you can see in this diagram, there are one, two, and this is three. Okay. We have got three cusps of the aortic valve, but congenitally some people have only two cusps of the aortic valve. So it also increases the risk of this aortic stenosis. Okay, and this disorder is um caused in adults only. Okay, and one more important point to know is that this aortic stenosis can also arise from chronic rheumatic valve disease. So guys, um, as the aortic valve is stiff, the blood is pumped is not pumped well enough to the body. Okay, so what will happen that the blood which is being pushed from the left ventricle into the aorta is not it, it is not getting properly into the aorta. Okay, so what will happen that the volume overload will cause the concentric left ventricular hypertrophy. Okay, and the reason behind having angina and syncope with exercise is that the is that our aortic valve is stiff. Okay, so our blood can't go to the heart and the brain. Okay, so it causes angina, which is also called a chest pain, and syncope, which means loss of consciousness. Okay, and uh, and also we can see microangiopathic humility anemia. Now, what do I mean by this? So this microangiopathic humility anemia is basically the anemia which is caused when the this RBCs they become destroyed. And why do they become damaged? Because because this aortic valve is stiff. Okay, so this blood is pushed very hard. Okay, so in that process the RBCs might get damaged. Okay, causing the microangiopathic hemolytic anemia. Okay, so these three are the complications of the aortic stenosis. So guys, that is for today, guys. And in my next video, I will discuss the aortic regurgitation, mitral valve prolapse, mitral valve regurgitation, and the mitral stenosis. So till then, yeah, just study hard and thank you for watching and bye. And remember to subscribe कर जल्दी, ठीक है ना? Subscribe कर जल्दी.